In 1974, a small community clinic opened its doors in Oakland to provide bilingual mental health services to a growing Chinese, Korean, Filipino, and Japanese population. 35 years later, Asian Community Mental Health Services now serves more than a dozen ethnic groups. Although the faces of our clients have changed, the struggles they encounter echo through generations.
So like I said, I grew up in Oakland, and a lot of the issues I saw surrounding what I grew up with is still prevalent today. So a lot of the youth that we work with, specifically Min youth, face a language barrier between parents and intergenerational barriers and lack of understanding, having to build and shape their identity between two cultures and finding that balance and instilling a sense of pride.
Faced with war, displacement, and genocide, seeking resources, freedom, and opportunity, our clients have transplanted their lives and have taken root in America. ACMHS staff meet their clients on common ground, sharing language, culture, and personal journeys that gives them a unique understanding of this community's needs.
I came here 20 years ago as a Vietnamese refugee. And then after a lot of people come here after me, and I can identify that situation with me. That's why that interested me to work here, in order to serve people who came behind me, after me.
After the war in 1975 to 1979, the populations Cambodian has tremendously changed, and I understand that they suffer with psychological problems. There has been trauma and also multiple loss during the war, as well as myself I've been through. And when I come to the United States, I feel there is a need, there's a call for me to come and help my community.
I feel strong about helping them because my uncle, who was killed in the Khmer Rouge, he was also disabled and we didn't find him. So in a way, what I'm doing is almost like I'm doing it for him.
Another thing is that my own background growing up as an Asian immigrant child and seeing what my parents went through. We came from Hong Kong, and my dad and my mom's status just dropped, and they had no money, we had no insurance, and we were going through a lot of struggles, but we didn't have services that were speaking our language. So we were just, struggling on our own, and that kind of helped me relate to Asian immigrant families and what they're going through, and for me to make a difference in that way.
I came here also as an immigrant, first generation, and I see that trend also. I mean, I lived in what's called the ghetto, went through the social service system, and I know how hard it is for new families, new immigrants, and working with the Asian community.
I was born in the Philippines and faced very similar problems that our young people face. And then access to resources was really a big thing for me. Didn't have much growing up, went through the public school system. So very similar experiences to the young people that we work with.
Well, I was born and I grew up in Oakland, and I actually went to the Chinese school across the street. So I am very familiar to Oakland Chinatown, and I always remembered walking around Chinatown with my family and seeing the different ages of people, of Chinese people, and sometimes I saw more that were more impoverished, and sometimes some that were better off. But then I guess that experience made me know early on that when I grew up, I wanted to do something with the Asian community. I wanted to be part of an organization that served the Asian community in a meaningful way, something that would impact their lives.